I've got this first case that I want to present. She's a thyroid patient. I couldn't present yesterday because of some very nice presentations and delay. Basically, she's a 43-year-old Malay patient. She was referred by the endocrinologist to me for progressive bilateral eye swelling over a 6-month period. And she was also losing vision. So initially she was very hyperthyroid when she first saw the endocrinologist, but the endocrinologist did a great job, controlled everything, and patient actually saw an ophthalmologist before coming to me and was already treated. And she was distressed, so at this point she didn't want any face photos. So an examination of, she has bilateral poor vision, much worse in the left eye, and also signs of compressive optic neuropathy, and certainly a restriction of extraocular motility in most gazes of direction, and she was definitely active. So the MRI scans were done, which showed apical crowding, left more than right at this juncture. And certainly this is primarily due to the bilateral medial recti enlargement, which is also more significant on the left side. So at this point, I decided she needed bilateral surgery, but I decided to do the surgery stage as, you know, I'm by myself. So I proceeded to do a 3-wall decompression to target the medial wall, posterior floor, and after that you take out the posterior strut, which I feel is very important for all these compressive cases. And then subsequently give the patient 1 cycle of pulse subsequently. So this photo was taken day 2. As you can imagine, the left side, you know, it's got the beneficial effects of decompression. It's already showing some significant difference in proptosis between right and left. So vision improved slowly over time. But at this point in time, I say, okay, let's do the right eye, but she was just not keen for, you know, despite my very, very strong urging. And unfortunately, the right side deteriorated as well. And this happened over a 3-month period. And then subsequently, one day, she turned up at my clinic for this reason. So I went to do a CT scan. Okay, so the left side is already decompressed. And now right side, the medial rectus is even bigger. So I said, we have to do that right now. And she was agreeable because vision was poor. And then, so I did both sides, and these were the scans, both sides. And actually, I felt that the decompression was adequate. And at this juncture, right, I think this was a couple of months after the right eye was done. Vision was 6:15 and 6:12 respectively. So this was the 6-month post-op photo taken in my clinic after both sides done. Actually, her double vision improved after the decompression. And then her main issue now with regards to diplopia was that she still had this right hypotropia and deficit of upgaze of the right side. But she actually says, you know what, I'm not experiencing double vision, I'm not keen for squint surgery. But instead, she wanted her appearance corrected and she was keen for eyelid surgery. And then I proceeded to do a bilateral upper lid blepharotomy, and I put the right upper lid on traction for about 10 days. Oops. And this was how the patient subsequently appeared at the end. Vision is good, and you know, she's very happy. Okay, my next case, this is a young lady. I thought she was a good candidate for fat decompression because she just wanted her eye prominence improved. And she actually prepared these photos and she sent me of herself previously and then subsequently now. And then the CT scans which were done showed no significant recti muscle enlargement. It was mainly involvement of the fat compartment. So I went to do, you know what Dr. Kashima spoke about yesterday, I went to do a bilateral opto fat decompression. This is mainly intraconal fat. 3 mils on both eyes. It was like 2.5 on one side because my nurse threw away 0.5. I say, no, I need it. I put it in a syringe and we measure. And this is how she looks. And I think the results are good. But I've started with about 3 mils first, and I'll slowly maybe progress the way. And the reduction is already about 2 millimeters. It's I feel a very neat procedure, but there's definitely a learning curve. And I had a long discussion with Dr. Kashima. I think the use of a microscope to really visualize the details properly, I think that's very helpful. And I would like to ask Dr. Kashima about his post-op care, maybe later. The next.
Thank you.